Now we have alumni chapters in Beijing, Shanghai, and Hong Kong. Our goal is to keep Brandeis community close. Alumni can support each other, especially to those new graduates and young alums. The ChinaFocus Deis is a series of alumni panels where Brandeis alumni in China share their experience and the insights on a particular sector of the Chinese economy. In tonight's first installment of the series, we will be discussing China's healthcare sector, and we are honored to have with us Roberta Lipson, John Tsai, Tao Wu, and Grace Wang as our panelists to discuss this sector. Grace has some technical issue. I hope she will join us very soon. So first of all, can each of you introduce yourself? We'll start from Roberta.
Good evening, Sean, and good morning or evening, everybody else, depending on where you are. My name is Roberta Lipson. I'm proud graduate of Brandeis bachelor's program in 1976. And since 1979, I've been in China first as an employee of a trading company, then as the founder of Chindex International, then as the founder of United Family Healthcare, and now as the CEO of New Frontier Health, United Family Healthcare. And I'm really happy to be with you all and looking forward to our discussion.
Thank you, Roberta. John, can you introduce yourself?
Okay, good morning and good evening. I'm John Tsai. I graduated from the health school PhD program in the health policy major in 1996, officially 1997 with the graduation ceremony. So afterwards, I worked in Boston for a consulting firm, then for Massachusetts state government in the Department of Health Human Services. I was involved in the Romney Care, the Massachusetts healthcare reform. Since 2006, I started come back forth between China and the US. Until 2012, I came back full-time, worked for a business school called the China Europe International Business School. 1 year ago, I left CIPS. I created my own consulting firm in the healthcare consulting.
Thank you, John. Next, Tao Wu, could you just briefly introduce yourself? Thank you.
Okay, thank you. Yeah, hi. Good morning, good evening. My name is Tao Wu. My life is simple. For the first 23 years, I stayed in Beijing. I was born there, and I stayed in Beijing until finishing my college at Beijing University. And then I went to Brandeis for graduate school. For the next 22 years, I worked on a new technology for breast cancer screening called digital breast tomosynthesis, also called 3D mammography. Actually, I did my PhD project at Massachusetts General Hospital. And after graduation in 2002, I stayed in MGH for another couple of years. And then in 2005, I joined the company Hologic. Probably some of you know that company, working on women's health. I spent 5 years in R&D developing the product, and then another 5 years traveling to Asia Pacific, promoting this new product, new technology. And then there's some major changes with the company. So I left in 2015 after 10 years serving the company. I started this company in China about 3 years ago in 2017. This company, I call it dark imaging, also working on pretty much the similar technology like digital breast tomosynthesis, but in China. And we actually optimize the technology for the local Chinese population. So that's what I've been doing. Nice meeting you here.
Thank you, Tao, and thank you all for your introduction. I think Grace also still has some problems, so we will let her jump in when the problem is solved. And for today's agenda, Roberta and John will first give a 15-minute talk. Afterwards, they will be joined by Tao Wu and Grace for a panel discussion, and end with a 15 to 20 minutes Q&A. Before Roberta's speech, please note that this event is being recorded. All attendees will be muted throughout the event. We received many questions in advance of the event, and we encourage you to submit questions during the event as well. If you would like to ask a question, please write it in the chat to Brandeis Alumni Office. We look forward to getting to as many questions as possible. And now, without further ado, please welcome Roberta Lipson, who will give a talk about her understanding of the Chinese healthcare industry. Thank you.
Thank you so much, Sean. Well, good morning, evening again, everybody. I want to share with you something about my own experience on my journey in healthcare in China, as well as my view of the market and the opportunities. I began my journey to China almost 50 years ago when I got the bug to study Chinese after getting the inspiration from my first Chinese history class at Brandeis. Back then, there was no Chinese department, only a smattering of relevant courses in the history, politics, and fine arts departments, and no Chinese language offered at Brandeis. But because of the flexibility of Brandeis, I was able to piece together a major, get credit for my unstructured junior year abroad in Taiwan, and gain the confidence and foundation to embark on a lifelong journey that intricately wove my love of China and my interest in healthcare together with the strong thread of understanding that both China and healthcare and the US-China relationship are of key importance to the future of world well-being and peace. I've been blessed with an entrepreneurial career and the opportunity to build a business that responded to the unmet needs in the healthcare space over time. When I first arrived in China in 1979, it was just after the opening up of the country to Western business. The country had been literally closed to the importation of modern medical equipment for the full 10 years of the Cultural Revolution. And before that, the only imports came from the USSR. China itself really didn't have a medical equipment industry to speak of. As such, there was a crying need for every piece of modern medical hardware that had become essential to the practice of modern medicine over the previous 30 years in the rest of the world. Therefore, we were able to build a medical equipment distribution company that was able to answer the most basic needs, filling the gaps in medical imaging, diagnostics, and patient care. Through the 80s, Chinese hospitals became increasingly well-equipped, thanks to the efforts of our company and others from the industry that slowly began addressing the Chinese market. However, it was clear that there was rampant dissatisfaction with the care and the service that was available in the public system, despite the fact that they had better and better hardware, and there was no private alternative except for a smattering of iffy standalone STD clinics. So we saw an opportunity to meet a market need by providing a different level of healthcare services with the patient at the center of evidence-based service, but with equal respect and care for the medical professionals. Of course, there were no clear regulations about opening such a foreign invested facility and no roadmap to make it happen, but we saw the need. At that point, we were a distribution company without a huge cash reserve. There were no angels or PE in China to turn to, so we had to do an IPO. We raised enough money to open our first small hospital in Beijing. And as many of you know, the rest was history. We slowly built our brand, and as we expanded our services, now, after being public on the NASDAQ for almost 20 years, a subsequent corporate privatization, being listed again on the New York Stock Exchange in 2019, and now being on the road to a second subsequent privatization, we have a healthcare platform consisting of 7 hospitals going on 9 and 14 clinics, as well as an internet hospital platform, which is about to go live. I tell you this history because I hope that through the history of our company, you can have a window on the evolving opportunity of the healthcare market in China. Over these years, not only have consumer attitudes changed and their appetite for products and services rapidly evolved, from embracing all kinds of supplements, TCM, Western medicine, high-tech interventions, gene and targeted therapies, and now all kinds of wellness and anti-aging services. And so have the government's policies and attitudes toward private participation. They've also evolved. Evolution happens continually, but we have also seen some quantum revolutionary changes as a result of events such as SARS, which brought new approaches to infection control and hospital design, as well as huge increase in the demand for health insurance. Health insurance premiums grew by 309% in the 3 months after the outbreak of SARS. We also observed that COVID-19 definitely improved public awareness of healthcare, which also leads to expansion of the commercial insurance market. And the more careful consideration on choices of health and wellness have become commonplace. For example, in the first 2 months of 2020, the total premiums of insurance overall only increased by 1.1%, but health insurance premiums increased by 22.1%. After the Wunshan earthquake, demand for air and land ambulances and emergency services and equipment skyrocketed. And in our COVID year, we saw consumer acceptance of online medical services and the growth of internet hospitals growing at an unheard of rate. Government policy supporting this new consumer willingness to go online also liberalized with unprecedented speed and efficiency. As of July 16th, 2020, there were 711 internet hospitals developed in mainland China. About a third of these hospitals that were established at the beginning of 2020 as an emergency response to the COVID-19 epidemic. The 711 internet hospitals consists of the following 3 types of facilities. 6% of these online platforms are government sponsored. 5.9% are government sponsored, and only 20% are started by hospitals. And the rest, the majority, or 74%, were started by purely commercial enterprises. That means Ali and various other platforms that may or may not be tangentially related to healthcare, or might just be online sales platforms, registered and started internet hospitals. Anyway, the dramatic increase of internet hospitals in China has played an important role in the prevention and control of COVID-19. Internet hospitals provide different and convenient medical services for people in need. But I mention this because it's really an anomaly to see a whole new sector just grow out of almost nowhere in almost no time in response to an outside societal stimulus like the epidemic. When looking at opportunities in the industry, one has to be open to opportunities afforded both through changes on the demand side, as well as to those afforded by changing government policies. Sometimes these 2 determinants of opportunity don't synchronize, and then it's the job of the entrepreneur to push along one side or the other and not just be a passive reactor to the status quo. Likewise, this horrific year of US-China relations has also brought challenges to those of us that are somehow related to the US, whether through our corporate identities, the origin of our technologies, or just by virtue of our Brandeis education. In this case, we must also not be passive bystanders to the situation. Healthcare cooperation is one of the few areas that both business and the public on both the Chinese and US side have profited from over 40 years. From a business perspective, China healthcare market is huge. Overall healthcare spending was 8 trillion yuan or $1.2 trillion in 2020, having doubled since 2012 and expected to double again by 2030. Every major US pharmaceutical company and medical device company is in China, both through exports as well as local production. Pharma spending in 2019 was 1.8 trillion yuan, also growing at an average of 6% over the last 5 years and about 16% for the previous 5 years. The medical device market was about $500 billion in 2019 and almost doubled in 2020, which of course was a bit of an aberration. In China, there are over 176 million people over the age of 65, up 50% since 2010. And the elderly population is expected to double to 360 million by 2030. Of course, this along with growing urbanization and lifestyle factors contributing to fast-growing rates of non-communicable diseases, including 4 million new cases of cancer per year, means the market will continue to grow at a rate that neither US industry or Chinese industry could ignore. In my own field of medical service, the Chinese health system used to be overwhelmingly dominated by public hospitals. Now, although private hospitals still only provide about 20% of the medical care, well over 50% of the healthcare institutions are private, and they own more than 2.7 trillion renminbi in assets. The opportunity for growth in this area is tremendous, and capital knows this. In 2020 alone, there were over 150 billion yuan in new public market healthcare financings. People of not only the US and China, but much of the world have benefited from collaboration in drug discovery and development, as well as international participation in the markets for medical devices and technology. Companies on both sides have profited from being able to participate. China has increasingly opened its market both to imports and investments, although many foreign companies still rightly complain that they have yet to attain full national treatment, either in tendering or in market access. Yet it would be impractical and almost impossible, given how important the China market has become to any company's bottom line, to walk away. In fact, US companies owe to their stakeholders to continue to find ways to continue to engage China to improve market access and even the playing field. In the field of medicine and public health, academic, industry, and government collaboration have been a hallmark of the US-China relationship from the earliest time. Until 2016, there were many robust collaborative programs led by the NIH, the HHS, and CDC, together with China's peer institutions, which included work on training, joint research, and capacity building in epidemiology, emerging infectious disease control, and other areas. Recently, this traditional strong point of the bilateral relationship has been greatly diminished, both due to the defunding on the US side and increasing fear and distrust on both sides. Compare the way both countries successfully worked together on the SARS outbreak of 2003 with the mutual suspicion and accusations we've seen in the past year over COVID. In the period leading up to the SARS epidemic, we had many experienced US public health professionals stationed in China working on joint projects. After 2016, much of the relevant funding from the US government was no longer available, and so there were very few American medical scientists or public health experts in China when COVID-19 struck. Those few who were here were fairly new and lacked relationships and access that could have helped avoid hundreds of thousands of needless deaths in the US and around the world. Part of the tragedy of COVID could have been avoided if both bilateral and multilateral collaboration in the field had not deteriorated so extremely over the 4 years of the Trump's presidency. To add insult to injury, in April of 2019, the Trump administration announced the US withdrawal from the WHO. Previously, the US was the largest supporter of the one organization that with the right support might have been able to coordinate a more effective response to the COVID challenge. When finally COVAX, a global initiative to address the equitable distribution of vaccines, was launched, Trump made it clear that the US would not participate. China joined the alliance in October 2020. Thankfully, on January 21st, President Biden announced his commitment to rejoining the WHO and to supporting COVAX as a priority initiative. The importance of strategic stockpiles in case of medical emergencies has become clear over the past year. US stocks of PPE and other urgent supplies have become seriously depleted. Our supply chains in these fields are in fact very mutually entwined. Decoupling them would most likely not solve this problem, but only exacerbate it by twisting supply chains in uneconomic, inefficient, and unnatural ways. Advanced strategic planning, reliable treaties, and collaboration could be a better way to tackle the problem. Not only do we all have a lot to gain from greater cooperation, both bilaterally and globally, but we have much more to lose if we avoid it. Of course, it's not black and white, and we need to work together to assuage the paranoia on both sides. Last month, I was fortunate to attend a reception for so-called foreign experts in Beijing, hosted by Li Keqiang. For most of the meeting, he talked about China's openness and inclusiveness on science and development issues. We were also pleased when he said, quote, "Scientists have nationalities, but science has no borders." Sadly, this was followed by, quote, "However, some technology might have to have borders due to IPR issues in a competitive world," unquote. At the same time, the government cannot deny that consumers demand whatever therapies or technologies will cure their illnesses, no matter where those medicines or technologies originate. We need to continue to work with both governments to ensure that we can have comfort in IPR protection and enforcement, equal treatment in national tendering and market access. Both China's cybersecurity law and genetics material law are impediments to collaboration in science, technology, and industry, partially because they have been too broadly interpreted. Paving the way to fuller engagement in medical science requires that these regulations be clarified and limited. On the US side, we have also work to do. Over the past 3 years, the climate in the US for academic exchange and scientific collaboration has been poisoned by the Trump session's so-called China Initiative, in which the FBI launched 1,000 investigations into alleged criminal activities by Chinese people or others with connections to China. In many cases, Chinese academics, students, and scientists were racially profiled, and some were falsely accused, often turning ethical lapses by individuals into accusations of illegal actions, including spying. Implications were made that all of these allegedly illegal actions were systematically coordinated by the Chinese state. This turned the halls of research and academia terribly toxic for Chinese students and scientists, causing many to rethink the US as a desirable location for study and research, and potentially depriving the US of needed scientific talent. The numbers of US students studying in China have also greatly reduced. This will make avoiding misunderstandings all the harder to avoid in the future. The world has made so many amazing advances in medicine over the last 40 years, not in small part due to openness and international cooperation. What has happened over the past 4 years to tear apart the framework, if not repaired, will not only stand in the way of progress over time, but could also lead to more immediate catastrophic consequences, just as we've seen in the last painful year. Hopefully, the new Biden administration and China's coming 14th five-year plan will see the importance of bridging the divide. Thank you.
Thank you, Roberta, for the passionate speech. We have learned a lot. And now let's welcome John to give his presentation about China's healthcare system after COVID-19. Thank you, John, please.
Okay, so let me share my screen. Because most of our career time was in for professor school, so I'm used to use my PowerPoint. I'm glad to hear Roberta talk a lot about the international relationship, especially between the US and China. I'm going to focus on the China's healthcare system, especially after COVID-19. So I would like to give you a lot of basic statistics to show you the big picture of the China healthcare systems. So that's the per capita healthcare expenditure in China. So the latest number we see, Chinese spend almost 5,000 RMB per capita. It's close to represent about $700 per person. We see the last 10 years, the increase rate pretty rapidly over the last 10 years. That's because after 2009, China started a new round of healthcare reform. So government increased the expenditure on the healthcare. We see China spend healthcare expenditure represent about close to 7% of GDP. Compared to the US, this number is much smaller. US spend about 18%. However, US is an outlier, spend much higher than most other countries. Okay, that's per capita expenditures. We spent almost $5,000, 5,000 RMB in the latest 2019. That's represent about 7% of GDP in China. However, we see the last 10 years, the increased expenditure for the healthcare increased very rapidly. We see the gap between China different population, especially between the urban and the rural population. So these are the basic number to measure the healthcare status. We see the newborn infant mortality rate and the 5 under children mortality rate between the urban and China. So the rural, the mortality rate almost double or more than double the urban, the mortality rate. We see the big gap in China right now. So this is the financing of the China's healthcare system. We often call the 3 row and the 3 columns. In the middle row, that's the ballpark basic. We call the basic social healthcare program. We have a 3 major program, 2 for urban, 1 urban employee, urban residents, and the rural population. The benefits and the financing number will be gradually reduced. Urban employees still have the best benefits. The rural population still have the lowest benefits. So on the bottom one, that's the medical system. That's usually for the really poor, vulnerable populations. the top one is the supplementary, the basic is the commercial health insurance, but that part in China is highly underdeveloped. Okay, so that's the basic financing structure. Also, we see this chart, that's the financing, the three major resources for the healthcare financing. And the top one is the individual out-of-pocket payment. Middle one is the social health insurance. The mainly it's the three major social insurance sponsored by the government I just mentioned. On the bottom one, it's the government directly expenditure. Government spend on the infrastructure, building, research, and some kind of directly payment for the public hospital employees. So we see the trend start from the 1978. That's the year China start the economic reform and open door. So we see the trend gradually out-of-pocket increase reached the peak time in the early 2000s, over 6%. So people talk the affordability issue basically related to how much people pay out of pocket. In the last 10 years, we see the trend just reverse. The out-of-pocket payment gradually reduced to 28%. This percentage compared to internationally, still not very low. We know that in the US, the out-of-pocket payment, it's about 13%, right? The US, the per capita healthcare expenditure is very high. However, most people, if you have a health insurance, it will be affordability issue will be minimized if you have an insurance coverage. Also, we see the number of hospitals in China. We see the trend in the last 10 years. China right now have 3,400 hospitals in total, including the private and public hospital, including a really large one. They have the largest one in China hospital with a 10,000 beds. The small one maybe only have a few dozen beds, okay? So we see the number of hospital beds right now over nearly close to 7 million, the total beds. Okay, we see the trend the last 10 years increase very rapidly. Also, that's the medical beds per 1,000 population we see gradually increase over the last 15 years, okay? So we see just Roberta talking about the public and the private sectors for the hospital. We see the total 3,400 hospital. Public hospital right now only account for about 1/3. Private account for 2/3. However, you cannot just be deceived by this number. See, look at the private sector in China become so dominated. No, we need to look at the other three number, the proportion of hospital beds, outpatient visit, and the inpatient stays. We see the public hospital account to about 80% of the total healthcare market share. So that's me in China for the healthcare services, public side still pretty dominant, account to about 80%. Also in China healthcare system, we see a very long time, it's a very serious problem we call the inverse upside down pyramid. I mean, the tier 3 hospital, they tend to, in US called the teaching hospital, tend to be large hospital, general hospital. On the bottom one is community hospital. For a normal size, should be most patients, they should go to community hospital first. If they have a serious problem, they are referred to tier 2 and tier 3. Because in China, without the formal referral system, most people just directly skip the community hospital, tier 2 hospital, direct go to the tier 3 hospital. This phenomenon in the last year, COVID-19 in the Wuhan and Hubei, become a very serious problem. If people have a symptom, have a fever, they just directly go to the teaching big hospital. They create a crowded situation in the big hospital. Also, they create a problem like cross-infections. So the big hospital in Wuhan tend to be all the physician, the beds become very crowded, okay? So a lot of other countries, even they have a more infected patient than in China, because they have a strong community hospital, people have to go to get first screen in the community levels. So they are avoid this kind of situation in Wuhan and Hubei. So we show you some numbers. We see the large-sized hospital in China after 2009. That's the year China start to have a new round healthcare reform. So we see the over 800, the large-sized hospital increase most rapidly. These hospitals tend to be in the top pyramid, we say. The small hospital tend to be under the community levels. We see the large hospital increase much rapidly than the middle-sized and small-sized. Also, we directly see the number, we see the, I'm sorry, I forgot to translate into the English. So the large part, that's the outpatient, inpatient, the distribution among the tier 3, tier 2, and the tier 1, and the undefined tier. So we see the really large portion is the tier 3 hospital. For the outpatient, account to 54%. For the inpatient, the tier 3 hospital account to 49%. That's means China, the tier 3 hospital, their number is smaller. The number, they only account to about 8% of the total 3,400 hospital. They only have 8%. However, because these kind of tier 3 hospital, they tend to be really large size. So they really occupy the almost half of the inpatient, outpatient. Also, we see after the 2009, the increase rate for the tier 3 hospital, no matter outpatient, inpatient, the increase rate is most rapidly than tier 2 and the tier 1, than the undefined hospital. Undefined hospital tend to be private hospital, tend to be really small-sized hospitals. So that's me in China. Even after new round healthcare reform, the government want to consolidate, want to strengthen the community level, the hospitals. We call the tier in China called the 分级诊疗, the tiering the service. However, you see the patient, they still skip to the community hospital, they skip the tier 2, tier 1, they direct go to the tier 3 hospitals. Also, then we see what's the reason behind this kind of upside down pyramid. We see the physician population ratio among the 10 countries with the most population in the world. The number, because the international number, they tend to be a little bit older. So we see China have the physician population ratio tend to be in the middle between these 10 countries. China much lower than the US and the Russian, a little bit lower than Brazil and Mexico. However, this number, China, more than double than the India. So look at this number, China seems okay in the middle. However, we look at physician education background. We see China close to 4 million physicians. However, only close to 60% of physicians, they with college and above education background. China still have more than 1 million with so-called physician. They only have a 2-year college, vocational school, only even they have a high school, even the under high school. So in most of the country, I believe, you don't have a college level education, you are not even qualified called physicians, MDs, right? So China used to call the barefoot doctor, but it's a surprise for most, even for the Chinese people. A lot of people even don't know. We still, for so many years, after 40-year economic reform and open door, we still keep so many barefoot doctors. Because we know the healthcare, we need best educated people to be a doctor, to treat people, more important than to treat the other machines, right? The technicians. So we see the paradox, it's very strange things. On the one side, we still need a lot of educated doctors to fill in the community level, right? But on the other side, we look at this number, we see this number after 1978, we break down into the first 10 first 10 year in the one rows. Also the last row, last row is the most recent 2 years. We see the column is the medical and the pharmacy college graduates. In the middle row, it's the among this period that's increased the physician. So these two numbers closely represent the physician supply and the physician demand. So we calculate supply-demand ratio. We see the first 10 years with the one graduate physician, one graduate students, physician increase more than about 2. So that's mean more than half of the newly increased physician, they are undergraduate levels. We see the second row is these two numbers close to each other. The third row, we see the 1998 to the 2007. That's the period China really very rapidly increased the college enrollment. Also, including the medical school, the enrollment increase. However, the definition of physician for this period, the Minister of China, Minister of Health, they are like tightened the definition. So these physician number tend to be smaller than the previous year. So we look at 2008 to 2017, we see much more increased graduates than the physician. Even the last 2 years, we see still a lot of newly graduated the medical school graduates. They could be the clinical physician. However, they change their career. They give up to be the physician. They're doing something else. Most people, they be the representative to selling the drugs for the pharmaceutical companies. So that's really the very strange thing in China. On the one hand, we really have a huge shortage of qualified doctors. So that's why in China, on the community level, so people don't trust the physician there. But on the other hand, we have a newly graduated medical school graduates. They could be the physician. They just switch their career. They give up to be the doctors. Okay. So then I'm quickly, due to the time, I quickly go to the impact after COVID-19. What's the major trend impact? So I'm summarizing about the 10 trends: public health and the preventive care versus medical care, because in China, in the last almost 10 years, we really put a lot of strength, spend a lot of money on the medical care. However, we don't put enough investment on the public health and preventive care. So these kind of things, public health, preventive care, will become more important after COVID-19. So the second trend is the primary and the community care versus tertiary medical. I just mentioned China still, most people go to tertiary care, but these kind of things will be after COVID-19 should have a gradual change. Primary care and community care will become more important. Also, we said O2O, online and offline. Last year, during the time, really COVID-19, because the offline, a lot of hospitals closed to the regular patient. So the online, the medical care, online pharmacy, online healthcare insurance become more active last year. So the online healthcare services will become more important after COVID-19. That's also mentioned, Roberta just mentioned. Also, outpatients versus inpatient, we see the trend, especially after COVID-19, the more and more service, something could move out of hospital, go to the community care, home care, day surgery, third-party service, like a third-party independent imaging, third-party the lab, a lot of things could be doing out of hospitals. That's also because last year, a lot of hospitals, they closed the regular service. Also, the diagnosis become more important, diagnosis versus treatment, especially the last year related to the COVID-19 diagnostic, this kind of service become really very important. So we believe diagnosis in the future for the preventive care, for the community care will become more important, even for the chronic care, for the aging population in China. We believe the diagnosis could be even like a COPD. People could do some kind of simple diagnosis even in the community, even at home. So diagnosis will become more important. This subsector of the healthcare will become more important. Also, in the last year, COVID-19, the traditional Chinese medicine really play a very important role. We also see the trend is really right now to help and favor traditional Chinese medicines. Also, software and hardware, I mean the software, that's mean the medical health, human services, and information technology. I just mentioned China used to spend a lot of money on the hardware, on the infrastructure. They pay the doctor, pay the money on the people, on the nurse, on the public health staff, really not enough. So that's made the healthcare career become not as attractive as in most of other countries. So this kind of trend should be gradually corrected. Also, private versus public healthcare. So private healthcare in China, the last 10 years, the gradual increase, especially number of hospitals increased a lot. However, their service portion doesn't increase enough because private sector in China still couldn't really to attract the most talented people from the public sector. We hope the trend will be gradually private sector in China will become more and more important because Chinese government, the budget become tighter and tighter. They don't have enough money spent on the public sectors. So this is the trend we hope will be gradually changed. Also, another trend we call the consumption medicine versus serious medicine. Consumption medicine, what I mean, it's people spend on the preventive care, especially last year, for example, like the face mask, a lot of even the preventive, a lot of this kind of nutrition, these kind of things pay a lot of attention. They are not belong to the serious medicine, but this kind of we call the consumption medicines. They will become more and more important because people will pay a lot of attention for the preventive care, for the family, this kind of preventive goods and the services. The last thing is the peace versus wartime. What I mean, peace is the strategic medical supply system and some kind of logistic. Especially last year, most of the country, they found they have the problem. They don't have a good preparations. They don't have a lot of drugs, medicine. They don't have a preventive device, and a lot of supplies have a huge shortage. Also in China, I give example in Shanghai at that time, in the Shanghai, during the early last year, they found in the warehouse, we only have 300,000 face masks. In China, the medical staff almost close to that number. So that's mean only in the warehouse, the face mask only could use for the one times for the medical staffs. But the Shanghai government found the Hong Kong government in the Shanghai, they have a huge storage of the face masks. They have almost 15 million face masks in Shanghai. So that's me. During the COVID-19, post-COVID-19, Chinese government really start to pay a lot of attention to this kind of strategic medical supply systems in China.
Thank you, John, for the very great speech. And we really learn a lot from the Chinese healthcare system. And now I think we can get into the panel discussion. We have Roberta, John, and Tao Wu to join us in this panel discussion. And during the discussion, if anyone has any question want to ask, please just send out to the chat, that box. First question I have here is, China's birth rate dropped severely in 2020. It's the lowest in 20 years. And with just about 10 million new babies were born all year, compared with 26 million in 1990. That's more than 60% drop. Adding to that, the aging population is getting larger, with 250 million people over 60 in the end of 2020. And the number will be doubled by 2050. So how do you think that China's plunging birth rates and the aging population will affect its healthcare system. Roberta, would you like to take that question first? Okay, maybe.
Yeah, so sorry. So all kinds of problems are going to come out of that. It's really something very, very scary. Not only if you look at the drop in birth rate in 2020, but it's been increasingly bigger drop for the last like 10 years. And so where that's going to end up is going to be with not enough of a workforce unless we do amazing things with automation. It's going to be a challenge to the economy. And it's going to be a challenge, a super challenge, on the one hand, to the healthcare system, because of course, people in the last part of their lives are much greater consumers of healthcare than in any other part of their life. So it's going to put a very big burden on the one hand on the healthcare system. On the other hand, it opens up all kinds of opportunities for healthcare providers. And it's definitely not only healthcare providers, but people who are meeting the consumer needs of those older people. So from our perspective, where we were originally best known for making babies in a really nice environment and taking care of little babies, we have been working hard on developing our geriatric capabilities. And so every one of our hospitals now offer special packages for checkups for people over 60 and specially customized design packages. We have hospice care, palliative care in some of our special facilities. And these are things that really the market needs to look at how to meet in a really sensitive way.
Thank you, Roberta. John and Tao, do you want to add to that? Do you have anything more to say about the question?
I'm trying to ask Tao too, because I just finished talking. So maybe I add a few sentences, because many years ago, after I first went to the US, I'm seeing not many people in the shops on the street. So I really feel a huge sharp contrast compared to China, because right now in China, relative China still have a more population than the US, because the ratio between the younger population and the elder population, so that's a problem. We see Chinese government start to just recently to losing the population control, especially in the northeastern provinces in Dongbei in China, start to allow people to have a more, because I'm afraid even you losing the control, still people don't just, the willingness of the give children still substantially just minimized. The one major problem I'm thinking is the housing price in China, because that's a huge cost for people to have a children. Because interesting, I just moved to my first apartment in China, in Shanghai. So right now I live in a very small 100 square meter. That's not the living range. That's called the construction range. It's about 800 square feet, probably equal to the US. So however, this house more expensive than the house I have in the suburban Boston. But my suburban Boston, the house much huge than this one. So I just still couldn't understand the reasons. In China, we have such kind of high housing price. So if we don't resolve this kind of problem, I'm afraid no matter you ask people to have many children, if you want, people really don't have the money to raise their children. So I don't know how to resolve these problems.
Thank you, John. And Tao, you want to add to something, or we move to the next question?
Well, this is beyond my expertise. I have only one child.
Okay. Okay.
Um,
You have
not a
made
good
your
example.
contribution.
Yeah, I'm sorry.
Okay, I'll move to the next question. It looks China's healthcare system is a bit different than the US and the other Western countries. You won't see government representatives negotiating price with big farmers and making them, face the toughest customer ever. What role does government and the private sector play in the funding of China's healthcare system? And the first part of the question we want to discuss in terms of how healthcare system, how healthcare treatment is funded in China. And the second part, we would discuss how do you view the healthcare startups and the venture capital market in China. I think the first half, John and Roberta, you probably have more experience to share with us.
Yeah,
John, you want to go first?
Yeah, my numbers already show some kind of big picture. So in China, the proportion of the healthcare expenditure out of pocket amount to close to 30%. So it depends on what kind of insurance coverage you are. If you are urban, you have a formal job, you are the employee programs, especially if you have a good company, they provide some kind of implementary health insurance, probably you spend a small percent out of pocket. If you're a rural population, you spend quite a high proportion. I got an impression number, it's in the rural population, you spend at least out of pocket equal to maybe half and half. Half is out of pocket, half covered by some insurance. If you have a really serious the healthcare problems, you will be quite easily end up into the poverty. So that's still quite a serious problem. If you are unfortunately have a really big problem, you have like a cancer, some kind of do a big surgery, so that will be still problematic.
Roberta?
Yeah, so yeah, the numbers are the numbers. The amount of out-of-pocket participation from individuals is now something under 30%, whereas John told us that the government was about 30%. So what's left is the other 40% or so is paid by our employers. And so it's really the burden of society as well. And comes out of I guess, the overall salary and benefits package of the individual. So in many ways, it's, you have to add the 40 and the 30 together, and that's juxtaposed to the government's 30%. So the problem is that when you want to get contribution by the government's 30%, or even the 40% that comes from your employer, you have to go to designated public hospitals. So you can't bring that benefit to United Family and get treatment there, or even bring that benefit to United Family, pay extra and be able to get treatment there, or buy supplementary insurance. So right now the government is only, for the most part, reimbursing public hospitals or hospitals that are willing to and able to charge the same amount for their services as would be charged in public hospitals. So there are a few exceptions. There are a few exceptions in Shanghai. Our Tianjin Hospital and our Qingdao Hospital both have exceptions. You did, Sean, ask something, I'm not sure I understood it, about would we see the government negotiating with pharma companies on price? And the answer is yes. This centralized tendering for pharmaceuticals over the last few years is the really big, bad, scary thing going on for pharmaceutical companies, volume-based purchasing, which has gotten the price of many pharmaceuticals down substantially. I don't know, to even 10%, and also medical devices, maybe 10% or 15% of their formal price. And this is super scary for pharma companies, but I think it's worth noting that they're still willing to continue to do this business, so they must make some money at it. But you know, getting that right for the companies and the government, and convincing the government that it's not only the very low priced product that's going to be most efficient for them in the long run, that sometimes it's worth it to pay for a higher priced product, which will cure the illness quicker, or have less side effects or less toxicity. So I think this is a dialogue that's very popular now between companies and the government.
Okay,
Roberta,
thank you, Roberta.
Average reduce the price after negotiation with government is 50%. Pretty high drop of the price.
Yes.
Yeah.
Yeah, that's why I say that's the toughest the customer they're facing. So would you think the U.S. will take the same strategy, or to bring down the price? And what's the pros and cons of government involving in this kind of market activity?
Tao, would you like to answer that one?
I think Tao, I will leave him for the venture capital market, since he is a startup entrepreneur. Okay, so if nobody wants to answer my question, we will move to the next one. Tao,
I could answer a few sentences.
Okay, John, please.
I don't think government will take the same strategy like Chinese government right now doing, because the innovation of the pharmaceutical industry really is a very important strength for the United States. But most of the European countries, they are like Canada, the negotiation price with the private sector. Maybe the U.S. government will be, but they probably will do some kind of pharmaceutical, we call the health economic study, to provide some kind of evidence. But I don't think the U.S. government will be doing something similar like Chinese government and the European government, the way they are doing. I'm afraid in the foreseeable future, I don't see this kind of possibility.
Okay, thank you, John. Tao, we see a lot of Chinese pharmaceutical companies going public in recent years, especially when the 创业板 is opening in Shanghai Stock Exchange. So would you share with us your experience in, I don't know if you have raised money for your startup. Could you share some insights in that venture capital market?
Sure, yeah. Actually, I work on medical equipment, not really the pharmaceutical part of the business. I founded the company in July 2017, and in the same month, we raised about $1 million funding, the first round, for purpose of developing the prototype. And this funding is from a 100% private, a VC company. And then next year, we raised the second round of financing for $6 million approximately. And for the VC of this round, I mean, it's private, but one LP is a government fund. The government fund owns like 20% of this VC. This is very typical in China, like a mixture of a private and the government funding. And as a return, because the government is the LP of this VC, so they encourage me to have a subsidiary in the local city. Like that's where I am sitting now in Zhongshan, Guangdong province. So this can be like a win-win position because of the local government, be part of the VC, and they, as a return, they kind of attract startup companies to to the local city to create a job opportunity, to create a tax, and also to like kind of promote the technology and the industry in the local area. So this is my experience in the fundraising, and I think this is very typical in China, mixture of a private and the public.
Okay, thank you, Tao. I'll move to the next question. How has COVID-19 and the worsening relations between China and the US affected healthcare collaboration between the two countries? I think everyone can share your opinion on that. Roberta, would you like to go first?
Well, I think I mentioned that things have gotten really pretty awful. And how did COVID-19 make it more awful? There was already a terrible environment of mutual suspicion. And there were already very few public health people in the country in China when COVID broke out. And the US wasn't ready for it. It didn't have full information on what happened in China. And they made a mess out of the whole thing. So in response to the fact that we didn't help each other, the US blamed China on the COVID outbreak. And China looked at the US and laughed at its response and lack of effective response. So it was, it was absolutely terrible. And this was on the background of the China Initiative, where Chinese academics were already feeling very put upon and uncomfortable. And I think it was just absolutely awful. At the same time, we were dealing with two new laws that also stood in the way of collaboration in healthcare, one being the Human Genetics Material Law and one being the Cybersecurity Law. And both of these laws have been, in light of the mood of ultranationalism and concern about making a mistake that people will get in trouble for, these regulations have been interpreted in very broad ways. So whereas the Human Genetic Material Law says that you can't send abroad Chinese genetic material. So we recently had a collaborative research project where we worked with some American doctors to look at a quick approach to testing for cervical cancer. And through our screening and large-scale screening, all of the cases where there were tissue changes, we took those biopsies back to Beijing, found out if the women needed further treatment, and had pictures of the tissue biopsies. And our partner said, you can't send those pictures abroad because you will violate the Human Genetics Material Law. But they were two-dimensional pictures. There was no genetic material being included in it. You can't tell what the genetic makeup is of a piece of human tissue by looking at a picture of it. So, it's those kinds of overinterpretations that get people super nervous, and it really slowed down the results of an important research project. So things like this happen.
Thank you. Okay, so we'll move to the next one. What advice will you give alumni who wish to start a career in healthcare, whether it be the first job or those looking to switch from another industry? John, I know you have a consulting company. which advise the professional and also people who are not from the healthcare industry. Would you like to share something on that?
I work in China Europe International Business School. We have a lot of students. They want to, MBA student, they want to switch career. They don't have even don't have a healthcare background. They want to work, switch to the healthcare. They spend 1.5 years at school. They are be able to go to my courses, also participating a lot of activity. They also do an internship. They do a research project with the healthcare. So I see quite a students after they spend 1.5 years due to this kind of participating activity, go to lessons. They are to talk with alumni in the healthcare field. They're able to switch to healthcare. Also depends on what segment of healthcare. If the pharmaceutical industry, some kind of jobs really they need to have a really training. Some of they don't really, depends on what kind of subsector. Also depends on what kind of function of the you are going to take, right? If you do some kind of human resource marketing, something maybe you don't need a lot of like specific knowledge for the healthcare. Some they do need more trainings than the others.
Thank you, John. We also get question from the audience. First question is, what role does traditional Chinese medicine play in China's healthcare? Is it widely used among the public, and is it covered by insurance? For example, is acupuncture covered by insurance?
Well, I'm a big believer in traditional Chinese medicine. In all of our hospitals and clinics, we do have departments of traditional Chinese medicine. The hospitals of traditional Chinese medicine in the public system tend to be administered by a separate administration. So the two fields are quite separate. And it's very rare to find Western medicine doctors in China that believe in traditional Chinese medicine. And that's a shame, because I see the best results where our Western doctors and Chinese doctors collaborate. I think there was also a question in the notes that do some people end up missing their diagnosis or missing a cure because they've stuck to traditional Chinese medicine. And so I think the answer is that responsible doctors of Chinese medicine know when to send their patients to a Western doctor. And responsible doctors of Western medicine should know when to call in a TCM doctor for certain cases. And is it covered? Well, acupuncture is covered by my commercial insurance. I don't know if it's covered by Chinese social insurance. John, you probably do.
Oh, yeah, it's still covered.
So.
It's covered. It's covered. Because almost in all the major Chinese hospitals, they have traditional Chinese medical, like the department in China. It's quite popular to have. Also, after I lived in the US for over more than 20 years, I first went back. It's a surprise to me, even a lot of young, middle-aged Chinese people, they really believe the Chinese medicine, especially Chinese medicine, for very good for some kind of things, for preventive care, for some kind of injury. It's like some kind of things. It really have their effects.
Okay, thank you. The second question is, could you please talk about the trend of abroad or online diagnosis and the treatment services which are provided by many agencies in China nowadays? How will these services and medical services provided by local Chinese hospitals affect each other in the future? Online diagnosis. Tao,
Robert?
Yeah, I can do that. Yeah, so as I mentioned, about 70% of the online hospital licenses have gone to places like Alipay, Ali, and Ding Xiangyuan, and online services that are already doing online sales of other sorts, and they've expanded into online medical services, which I frankly think is weird. They've been questioned about what is their motive and what is their objective. And for some of them, it's very clear it's a way to sell drugs. So in mass market sale of pharmaceuticals. So that's one approach. The other approach is about 20% of the online hospital service providers are started by hospitals. And there's been a lot of question about whether online facilities can only do second visits. They can't do the first visit diagnosing a problem. So it's like if you have a chronic disease, if you have high blood pressure and you want to check in with your doctor about medication, that's the kind of thing that's being done online and is very encouraged to do online. And then you can also just do general consultation online, which might not result in a final diagnosis and might just alleviate your fears until you can have an actual offline consultation. So in our experience, we get many new customers through our online services that would not necessarily have walked into our hospitals ever before. And many of those customers will end up becoming our offline patients as well. And they appreciate the fact that they can have continuity of care when it's more convenient to go back online with their doctors. Our existing patients also have taken up services very intensively, but we see in almost every case, an online appointment is followed in a pretty short amount of time with an offline appointment.
Okay, thank you, Roberta. The third question, would you please provide some suggestions on how college and the master's PhD graduates can navigate their ways through the careers in the healthcare field?
Healthcare theory.
I'm sorry, is that question on the chat?
It's yeah. The third question: what's your advice for those who are, looking for a career in the healthcare field?
Well, stay long enough.
We have a management training program, and every year we're taking young graduates or people who've worked for 3 or 4 years in related fields, and we have a 1-year management training program. So if there are any people who are interested in healthcare service delivery, I guess applications should open up sometime toward the end of the year.
Okay. Okay, I have a personal question that I want to ask Roberta and all of you, because John is starting the consulting company, so he is also an entrepreneur. When you start your startup, you start your venture, is there a hard time what's the hardest time, and how do you hold up, and what's your takeaways? Thank you.
Okay. Yeah. Although I started my consulting firm for the but this is a non-for-profit consulting firm, but I'm also the US citizen. I have a US passport. It will be difficult in China for foreigners to have open a non-for-profit consulting firm because other consulting for-profit consulting firm, you need to register, get sponsor for the one government agencies. So because I spent many years in China, I get quite well known among the government department and also among the healthcare industries. So through a lot of efforts, finally get approval by the government, by the Bureau of the Health in Shanghai government. They are the sponsor of our think tank. So we are not a for-profit company. We are not non-for-profit think tank. So that's why the process, the approval process is quite complicated. So, but that's basically, if you want to have no matter you're entrepreneur, or no matter what you do, you need some kind of resource. No, you need money, you need a connection, some kind of support. Also, Roberta in China spent almost 40 years, right, in China, have the United Family. Today's success, it's not the stuff from the one day. You need many years, this kind of the accumulate your resource.
Can I? Yeah, I was actually there are hard times all the time, and you just have to know that they'll pass. Yeah, often my hardest times are when something that's out of my control, like government not wanting to give me a license or things that I actually can't control. But then you just keep at it and eventually it all works out. But I noticed that Louis Wolf, who is an acquaintance and I want to say hi to, has asked the same question twice on the chat. So I'd like to respond as I can to it. And the question is a question about the anticipated future of institutional post-acute settings and home care. So rehabilitation hospitals have become the flavor of the year over the last few years. We have one rehabilitation hospital that took a very well, because all of our facilities are aimed at the very high end of the market. It took quite a while for that hospital to take off. And finally it has, and it's very well accepted, and we offer a very broad range of services there, from postpartum care to orthopedic rehab, to stroke, neuro rehab. And it's great, it's well thought of, and but there is a much larger market on the mid to lower end. And in fact, our biggest investors, New Frontier Corporation, has an investment in another company which just does rehab hospitals, and then of course, and nursing homes, and they're doing very well. And then of course there's also a big market for elder care, and you saw the way the demographics are going. How could there not be? And the government is very supportive and encouraging of anybody that wants to make investments in that area.
Thank you.
You're welcome. Bye.
Thank you. Thank you, Roberta. I think since Roberta already answered the fourth question, so I think that will be all for today. Thank you all, and for joining us in this event, and a special thanks to all our panelists for sharing their insights with us tonight. We look forward to seeing you at other virtual programs. So please continue to check your email, social media, and the alumni website for details about the future events.